You're the expert here when it comes to pneumonia. Some people may not know what pneumonia is. So what is this pneumonia?
Our lungs usually don't contain any germs. When our lungs are invaded by those germs, that germ could be a virus, that germ could be a fungus. There is a war that goes on inside those lungs. And the end result of that war is a disease we call pneumonia.
Good morning, good afternoon, good evening, or whatever time that you're listening to this podcast, or for those of us who are watching, welcome to the Health Podcast. My name is Hellen Shikanda. I am a science reporter from the Nation Media Group, and I have very interesting guests today. And I was just telling them before we got to this place that it's my time to learn, and I know you all are going to learn from them. So we are going to talk about a very interesting topic. And as we've already heard from the news, we've already seen everywhere that El Nino is coming. And we know that when El Nino comes, it's the cold season, and some diseases are likely to come about during the cold season. And one of those diseases is what we are going to talk about today. And we have specialists, experts who have been doing this for a while. We are going to talk about pneumonia. And we have three amazing guests that I'll let them introduce themselves, starting from the one on my left. Welcome to studio.
Thanks a lot. My name is Dr. Elijah Matolo. I'm the medical practice manager at Old Mutual Health Insurance. I'm a medical doctor by training with specialization in health economics. Thank you for having us today.
Amazing. Happy to have you here today. Yes, and the one that I can't see, but I can hear his voice.
My name is Dr. Jeremiah Chakaya. I am also a medical doctor, and I am a physician by training and a pulmonologist. I practice pulmonology. Now, what is pulmonology? It is expertise in care, prevention, and treatment of lung diseases.
Thank you for elucidating on what pulmonology is, because I'm sure not so many people know about that. Thank you for that. And the last guest to introduce themselves.
Hi, everyone. My name is Dr. Karuma. I'm a registered pharmacist and the chief pharmacist, Good Life Pharmacy, and I'm happy to be here.
Thank you. Karibu sana. So we'll start with you, Dr. Chakaya, our pulmonologist, because you're the expert here when it comes to pneumonia. Some people may not know what pneumonia is. Even the spelling of pneumonia, here in the village, some people say pneumonia and so many other pronunciations. So what is this pneumonia?
Our lungs usually don't contain any germs. In our language, we say they are sterile. And if the lungs are invaded by a germ, that germ could be a bacteria, that germ could be a virus, that germ could be a fungus, any of those little animals that we call germs. When our lungs are invaded by those germs, there is a war that goes on inside those lungs. And the end result of that war is a disease we call pneumonia. Now, this pneumonia will be characterized by certain things. Usually the person who has pneumonia will cough. That person will have pain in the chest. Usually that pain is not frontal, it is on the sides of the chest. And usually that pain could be, tends to increase when one takes a deep breath, or when one sneezes, or when one coughs. Usually most people with a pneumonia will also have fever, so body temperature elevation, and they may have some difficulties in breathing. That's what characterizes pneumonia. A doctor should not make, or a clinician should not make a diagnosis of pneumonia ordinarily unless there are those symptoms, and two, there is some form of imaging of the chest. So imaging means an X-ray has been taken or a CT scan has been taken, and it shows features that are compatible with pneumonia. In the absence of an X-ray, you need very special skills to be able to pick out certain signs that tell you that this individual has pneumonia. So in simple terms, pneumonia is invasion of the lung by germs, and that war between your body and the germs is pneumonia.
Thank you so much, Dr. Chakaya. You've talked about this invisible war that our lungs fight, and it's a war between the germs and the lungs. So I'd like to know what really causes this war. Like, what do you do? What predisposes you to get to this point that there's a war internally in your lungs?
So this is an invasion. It's maybe think of it as a terrorist attack or something like that. You know, you are or thieves have come into your house and you start fighting them. And usually when you start fighting terrorists or thieves, sometimes there is damage to the house which you had not intended to have. And that's exactly what happens in our bodies. These little animals we call germs are not meant to be in the lung. And when they get into the lung, we mount our defense, we activate our defense system. We call it our immune system. When we activate that immune system, we kill these germs, or we try and kill these germs. But in the process of killing these germs, we can also damage our own lungs. So our immune system can also lead to some damage to our lungs. That's the process. They should not be there. These germs should not be there, but when they are there, they elicit this process, and that process then is what is called pneumonia. There are certain people who are more likely to get pneumonia than others. Anyone can get pneumonia. So it's not that it's a disease confined to a certain groups of people and not others. But there are those that have a higher risk of developing pneumonia than others. For example, very young people or very old people, or people who have got some problems with their defense system. If you are living with HIV, for example, or if you have a chronic disease of the lung, or you have a chronic disease of the heart, and so on and so forth. There's a whole long list of things that can happen, or rather can lead to an increased risk of pneumonia.
Okay, thank you so much. I've heard of people who maybe their pneumonia was discovered late, and you've just talked about it not being ordinarily discovered, maybe by a general practitioner. There are some tests that need to be done. So what are some of the symptoms that people need to look at when they're going to hospital? What should doctors do to diagnose them with pneumonia?
So the usual way in which pneumonia will show itself, the usual way in which you will know that you have pneumonia is through the presence of symptoms. Symptoms is what you feel. And the most common symptoms are cough, fever, breathing problems, and pain in the chest. These are the most common symptoms. You don't need to have all of them. Sometimes it's only one or two of them that are there, but those are the most common symptoms. There could be other symptoms, headaches, joint pains, muscle pains, fatigue, and so on and so forth. Usually, for most people with pneumonia, the problem is short-lived. So if you go to a doctor and you've had a problem for the last 3 months or so, you're unlikely to have a pneumonia. These are short-lived problems. So usually symptoms have been there for days, maybe maximum 1 or 2 weeks. Symptoms that come rapidly and are characterized by the presence of things like cough, fever, chest pains, and shortness of breath that developed just a few days ago. Chances of that person having pneumonia are high.
Mm-hmm. Someone may ask, you may just have a cough, and maybe it's just common cold. It could be caused by something else. How then do you distinguish that this is actually pneumonia and this is just a normal cold? I need to go to hospital. What makes you give you that need to go to hospital because this is something serious?
So the way we tolerate things is different from one person to another. So I might get cough, fever, pains, and all those things that are characteristic of pneumonia. But I don't go to hospital quickly because it's like, okay, this is just the usual thing. It will go away in a few days or so. So, however, I think it's really important that if you develop symptoms that are suggesting you could have pneumonia, you need to seek medical care early, because pneumonia can kill. in the world today, every year, slightly less than 3 million people die of pneumonia. So it can kill. And therefore, the earlier one goes to a healthcare facility for evaluation, the better. Now, what should the doctor look for, or what should the clinician look for? Having heard the story, the doctor will examine that individual. And there are certain things that should be, if you don't have an X-ray, for example, there are certain things that would suggest that this individual may have pneumonia. There are certain sounds that if the doctor puts their stethoscope on your chest, they may hear certain sounds, and those sounds might identify you as a potential cause of pneumonia. But the confirmation that there is actual pneumonia should come from some form of X-ray. So you get a chest X-ray, and a chest X-ray shows a shadow on your lung. We know for sure you have a pneumonia. If you have not had an imaging study, you have not had an X-ray or a CT scan, the doctor can only assume it could be pneumonia, but they don't have proof that it is pneumonia. So you need an X-ray to prove that this is a pneumonia.
Mm-hmm. Okay. I think that's a wake-up call to people who shun the hospital, that they'd rather wait when it's worse, the situation is worse, before going to hospital. But when it comes to pneumonia, you've just heard from Dr. Chakaya that you need to get medical attention quite early. And the next thing we'll be talking about is sort of a cousin to pneumonia, which is influenza. And maybe you can just explain what really is the difference between influenza and pneumonia, and how are they related?
Okay, this is very important. I said at the beginning that pneumonia is a condition in which the lungs have been invaded by germs. And I say that those germs could be viruses, they could be bacteria, they could be other types of viruses or other types of germs. Among the list of viruses that can cause pneumonia, you have in there a germ called influenza. Just like the other germs, one of those germs is what we've been struggling with now for the last 3 years all over the world, the COVID-19 thing. That causes a pneumonia, but that pneumonia is caused by another, a different virus. So influenza is a virus that has been associated with infections in the breathing system, or what sometimes we call the respiratory system. Now, that infection, which is invasion of your respiratory system, your nose, your throat, your airways, and up to the lung, that infection can lead to a very simple cold-like, a flu-like problem, or could actually lead to a very serious illness, which is influenza pneumonia. So when we talk about influenza, we are talking about a respiratory or a breathing system illness that is caused by the influenza virus. And the range of problems that you can get can be from simple flu-like problem to a very serious pneumonia that can kill.
Uh-huh. Thank you so much, Dr. Chakaya. Before we come to Dr. Matolo, I'd like to ask Dr. Chakaya, we've talked about mostly the gloom and doom of pneumonia and influenza, but I know there's a solution to that, and that solution is a vaccine. And we have the pneumococcal vaccine and the influenza vaccine. Maybe you can talk a little bit about that. How does it work? Why do people need it? Yeah.
So fortunately for us, for both influenza and the most common cause of bacterial pneumonia, if you have a pneumonia, the most common bacterial cause of that pneumonia is a germ that is called this pneumococcus. And it causes in our country, for example, 50% of all pneumonias in this country among adults may be caused by the pneumococcus. This is a specific germ that is among the list of germs that cause pneumonia. It is one of the most common causes of pneumonia in the world and is responsible for almost 50% of all the deaths in the world due to pneumonia. And so, fortunately, there is a vaccine against this pneumococcus. That vaccine is called the pneumococcal vaccine. And everyone who has certain risk factors, who is likely to end up, if they get a pneumonia, for example, that is due to this germ, every person who has got factors that could lead to very severe disease when they get this pneumonia should be vaccinated. Similar thing for the influenza thing. The influenza is just one of the viruses that can cause problems in the breathing system. However, it is the most common virus that causes problems in the world, including our own country here. So influenza is the most common viral infection, and it can lead to outcomes that are poor, which is death. And for that reason, we also have vaccination against influenza. So those two, pneumococcus and influenza vaccinations, are very important to be given to people who could, if they get any of those pneumonias due to those two, if they get any of those, they could end up with a bad outcome. Those individuals should be vaccinated against those two germs.
Okay. Thank you so much. Before we come back to you on how the vaccines work, I'd like Dr. Matolo to chime in a little bit, because I know our president and even the health cabinet secretary have been talking about preventive healthcare and primary healthcare and whatnot, empowering community health promoters. They're called promoters these days, not volunteers. So I'd like to know, why is it important to have preventive healthcare? And I know vaccines are a way of preventive healthcare. Why is it important?
Thanks a lot. So prevention or preventive healthcare are a set of healthcare services that are meant to prevent a disease from occurring in the first place. So we talk about prevention being better than cure, and that is both from a financial perspective. It costs you less if you prevent than if you're curing it, but also in terms of how severe a disease becomes. It's usually better if you're going to catch it earlier. So prevention, there are usually three main types. So it's either primary prevention, secondary prevention, or tertiary prevention. So for primary prevention, you are trying to prevent a disease from coming in the first place. And that one, you have two main things. That is vaccination, which if you're getting vaccines like what Dr. Ari has spoken about, it will prevent you from getting pneumonia in the first place, or prevent you from getting influenza. The other bit about primary prevention is promoting healthy living. So when you tell people do not smoke, because smoking causes many diseases. So on the secondary prevention, what you're trying to do is you're trying to catch diseases when it's very early. So the disease process has already started, but you're trying to catch it when it's still very early, and you can screen for many conditions, including even cancer. If you catch it early, then you're able to treat and even cure it. Then now finally on tertiary prevention is the disease is already established and it's already causing symptoms, but you're trying to prevent it from getting worse. So assuming a patient who has hypertension, so it's a care that you're giving to prevent them from getting complications like stroke or kidney disease. So prevention is important because it improves the health of the population, and it's also cheaper for anyone, both at the household level, but also at a national level. It is going to be cost us less if we focus on prevention of disease rather than curative part.
If there's one thing that you, my listeners, should get from this, is that old adage from primary school that prevention is better than cure. And Dr. Matolo has just explained why this is important. And I'd just like to know, I know you're from Old Mutual and it has a package on the pneumococcal vaccine that Dr. Chakaya has been talking about. I feel like that is really such a good thing. So tell us about this package on getting insured by Old Mutual.
So what we have as part of our health benefits, one of the things is that we noticed that previously we used to focus a lot on curative, But when we look at the preventive side, one of the things we noticed is, and specifically for patients with chronic conditions, pneumonia becomes a bit more prevalent. So patients with kidney disease, patients with heart diseases. And so what we've done is we went out there and said, how do we prevent? Yeah, so we approached some of the companies that make these vaccines, because the vaccines, the prices were a bit out of reach for most people. So we had a discussion with Pfizer, who are the ones who make the vaccine that we are offering our clients, and they managed to negotiate a very good price that now made it possible to roll it out to everyone who needed it. So our vaccination program has 2 vaccines. So the first one is a pneumococcal vaccine for which prevents against pneumonia caused by the pneumococcal bacteria. But we also provide influenza vaccine, which prevents against influenza, the disease. So there are specific eligibility criteria. So we decided to focus on those people who needed it the most. So these are the seniors, people aged 65 years and above, and also those who are living with various chronic conditions. So chronic kidney disease, chronic lung disease, chronic heart disease, and several other chronic conditions. So it's a partnership that we are working with the Good Life Pharmacy. So and part of the reason why we decided to work with Good Life Pharmacy is because they have a widespread, they have very many branches where our members can get access to this. We also wanted to make it easy. People usually do not want to go to hospital. Yeah, so instead of asking them go to hospital to get vaccinated, we brought the vaccine closer to where they are. So most people will come across a pharmacy when you're just doing your day-to-day. Maybe you've gone shopping, you'll pass a pharmacy by. So said, let's make it as convenient as possible, and also make it as easy for our members to access this vaccine. So it's a service we are paying for it fully from for all our members who are eligible and who are covered by Old Mutual Health.
I think that's a good idea. And you've talked about Good Life Pharmacy, and unless you're living under the cave, maybe you've not heard of Good Life Pharmacy, but I know all or most Kenyans have heard of Good Life Pharmacy, and we have the chief pharmacist from Good Life Pharmacy here with us, Dr. Karuma. So, Dr. Karuma, how do people get these vaccines from your pharmacies? Is it administered intravenously, or how is it administered, by the way?
Oh, it's administered intravascularly. It's not intravenous, it's intravascularly, normally on the arm. Not a painful job, so nobody should be scared about getting it.
Yeah.
Generally, you don't expect a lot of side effects, not a lot of pain on the injection site, maybe for a few people, but for most people, you get the vaccination and you go back to your workplace. Yes.
So people with trypanophobia like me who are afraid of needles should not be afraid to come for the pneumococcal vaccine or the influenza vaccine, right?
It even help you not get out of that phobia of needles. It's not that bad.
Okay.
Yes.
So I understand that not everyone can get it. So what's the screening process like? How do you ascertain that this person is supposed to get it, this one cannot get it?
So for the flu vaccine, generally anyone can get the flu vaccine as long as you're past the 6 months of age and onwards. Anyone can get it unless you have allergies, you react to any of the ingredients in those vaccines. And number 2, in some cases of pregnancy, you might not be able to get the flu vaccine. For pneumococcal conjugate vaccine, anyone from the age of 2 months all the way to 2 years, let's say everyone can get that vaccine, but it's targeted to the young and the elderly.
Yes.
So that the people who would suffer pneumonia most get the vaccine. We don't have a lot of the amount of vaccines being produced are not very many.
Yes.
So we want them targeted to the right people. But if you come to a pharmacy, even of those ages, and you want to get vaccinated, you will still get the vaccine. Yes.
Okay. So I'll go back to Dr. Chakaya. You talked about the war, the internal war, the invisible war, like a terrorist attack. So the vaccines now come in as a solution. How do they work in our bodies?
So basically, vaccines work by imitating what your own defense system should be doing. Like I said, you have a defense system. It's a very elaborate system. It recognizes foreign things. So if we are thinking about Al-Shabaab, immediately they enter this country, somebody recognizes, the defense system of this country recognizes that Al-Shabaab have arrived. And there will be a war between us and our defense system and Al-Shabaab. And that's exactly the same thing that happens in our bodies. That war is fought in many fronts. It is fought by soldiers that are non-specific. They fight everything and anything. And they are also soldiers, these are cells that we have in our bodies, soldiers that are very specific. We also produce chemicals. We call them antibodies. We call them, all sorts of names. But all this war, this combination of wars is what, or mechanisms of fighting foreign things that are entering our bodies is directed by the defense system. And our vaccines mimic, basically stimulate our defense system to do exactly that. So for example, the pneumococcal vaccine will stimulate the production of antibodies. Antibodies are chemicals that will identify when they are attached to the germ that we call the pneumococcus. They attach themselves to that germ, and that germ then is killed by your body cells. So it's like you get this bad guy who has come in. You place something on that individual, and your policeman can identify that fellow easily and come and grab him and destroy him. That's what antibodies do. And the influenza vaccine works in the same way. So basically what these vaccines do is to stimulate your own immune system, defense system, to be able to do what that immune system would be able to do naturally. Now, unfortunately for us human beings, these germs had developed ways of avoiding our defense systems. They're very clever. They're very smart, these germs. They come in ordinarily. You don't recognize that they're there. They confuse your defense system, and eventually you get disease. But with a vaccine, we have identified the best ways in which our bodies fight these germs, and that way of fighting that germ is what is enhanced by the vaccine, so that you have better success in fighting the germ in case the germ arrives. And usually then that protection, that defense capacity that you have achieved is there for a period of time. For the pneumococcal vaccine, for example, that enhanced capacity to fight the pneumococcus is present in your body after the vaccination for up to 5 years, as it were.
I'm not sure if it's just me, but I feel like vaccines are that friend that you need. They'll fight for you. Anything that is said against you, they'll be there to fight for you. So I know, even if we talk about friends and the war and everything, there's some people who doubt other people, and there's some people who doubt vaccines. So that means that there's some myths clouded around all these things. Do you know some of these myths, Dr. Chakaya?
So the vaccine story has been affected by myths, misconceptions for a very long time. Human beings sometimes tend to be afraid of things because you don't know what the long-term effects of something might be. Human beings also sometimes feel like if I'm given a vaccine, it may give me very bad side effects and it could kill me. And like all human inventions, yes, sometimes for certain people, bad things have happened. So we cannot say that vaccines are completely innocent, that they will never give you side effects and stuff like that. Like all good things, everything in this world is poisonous to some extent. It depends on my body, the way my body is made, and the way I react to it. But generally speaking, vaccines are safe. They go through a very thorough development process. They have to be tested for effectiveness. Do they work? And they also have to be tested for safety. No product that is coming out of the pharmaceutical industry should be given to any human being anywhere in the world without confirmation that one, it works, and two, it is safe. But having said that, you need to know that occasionally things do happen, and they happen a lot, because there's no perfect solution. Even eating a lot of ugali can give you problems. The thing that we all think, oh, is innocent and we love it and what have you, it can give you problems. So there are things that happen sometimes. But generally speaking, vaccines are very safe and very effective.
I know Old Mutual has done a great job in introducing that as one of the health benefits to her customers. So I'd just like to know, just taking up from where Dr. Chakaya has just said about the myths and misconceptions, how are you demystifying this? Is it easy to convince people to get the pneumococcal or the influenza vaccine? How do you make them see the need of getting this vaccine?
Thanks a lot. So we have been doing a lot of awareness campaigns. We've been sharing information that is written and through either emails, we've been sharing e-flyers. We've also been sending SMSs, both informational but also some targeted to the eligible populations. So you said that we are targeting those who are above the age of 65 and those who have various chronic conditions. Yeah, so we've been doing that, but it's not, I wouldn't say it's been easy. The uptake, the initial one has been good, but there's still many more people that we haven't reached, and that's why we are trying to continue creating that awareness. So some of the concerns raised, of course, it's a question around safety. Because we also call to just get feedback from our members. So there's always a question around safety, but that has been spoken about by Daktari. I think the other question is also about recommendation. So when we tell our members you need to get vaccinated, some of them say yes, thank you, but let me first go and consult my doctor. Mm-hmm. Yeah. So if their doctor does not
approve of it,
a good recommendation,
yeah,
and not just saying it's okay, you can get vaccinated,
mm-hmm.
actually giving a strong recommendation that yes, I think you will benefit from getting vaccinated. So that becomes it. I think there's also a lot of myths also going around saying that vaccines do very many different things. I think there's also a question around cost, especially for patients who have chronic conditions tend to spend a lot of their covers for their management, the day-to-day. If I need medication, if I need to pay consultations to see my specialist. So sometimes they'll feel, this money could be spent doing that.
Uh-huh.
Yeah, so there's also the question around, do they feel they can afford? Yeah, and then and generally just awareness. So sometimes people hear about it, but they really need someone coming to them and explaining to them. So number one, what is a vaccine? What does it do? And why do you need it? And what are the benefits and the basically the potential risks? So I think a lot of it is really around awareness at the individual level, but also recommendation at the healthcare practitioner. So if they get a strong recommendation, then we know that they do take it up. I think the other bit is now around how do you also create awareness. We'll find, not awareness, but access. So we've largely done it within the major urban centers, but it's also because the awareness hasn't been that good. So, some people might not have had access. But part of what we are currently working on is just making it available in all the major towns, whether it's within Nairobi, Kisumu, Mombasa, and really all the places where our members are.
Mm-hmm. Thank you very much. For the people who've been wondering what is a vaccine, I believe this podcast, from what we've just had, the discussions we've just had a few minutes ago, have helped. So, Dr. Karuma, I know the Pharmacy and Poisons Board has a pharmacovigilance section. That means people can report some of the side effects that they get. I'm not sure if any of the people who have come to Good Life to get this vaccine have reported any side effects, and if any, what are some of the side effects?
So generally, we've been on this vaccine drive for the last 3 years now. With Old Mutual, it's almost a year now, if I'm not wrong. We've not picked a lot of adverse effects. We picked quite a few, but we've not picked a lot of adverse effects. As I said, the most common adverse effects are pain on injection site, which clears after some time. We've not had the major side effects like the anaphylaxis or major what would call a major event.
Maybe you could explain what anaphylaxis is.
Severe allergic reaction.
Mm-hmm.
So we've not had those kind of reactions in any of our stores. But that's a very good question, because whenever we pick whatever kind of side effects we get, even those on injection site, we normally report them through the pharmacovigilance portal through the PPB.
Mm-hmm.
So all of them are recorded there. All of them are also recorded as incidents in our stores. There are not many, as I said, because I've reviewed them. There are not many. So as Dr. have said, it's generally a safe injection to have, as long as you gone through the right processes, as in you've gotten the right recommendation, you're the right age, and everything that works out. It's a very safe vaccine.
Mm-hmm.
There's very safe vaccines.
Mm-hmm.
Yes.
I was reading this morning at the CDC website, and I understand that there are different types of the pneumococcal vaccine. Sorry. So which ones do we have in Kenya or at Good Life Pharmacy?
Without mentioning brand names, I'll say what we have is a pneumococcal conjugate vaccine.
Mm-hmm.
It contains 13 of the most common. It contains fragments of 13 of the most common bacteria that cause pneumonia.
Yeah.
So it gives you that protection from the 13 causative agents.
Mm-hmm.
Yes.
Okay. So earlier we were talking about not every pharmacy can have this vaccine. So what is required in terms of storage, supply chain? What do people need to do if maybe there's a pharmacist that needs to stock this so that their people can get it? What is required?
Let me put it this. All pharmacies that are registered by Pharmacy and Poisons Board should have the capability of stocking these vaccines, mm-hmm. because they have the right cold chain products. They have the right cold chain material, mm-hmm. things that can maintain cold chain. They have the right personnel. Mm-hmm. So any pharmacy that is registered by the Pharmacy and Poisons Board and approved to practice in this country, mm-hmm. should be able to carry all vaccines in this country. Mm-hmm. Now the challenge comes that some of the vaccines, actually don't call it a challenge. There are 3 classifications of vaccines. You have routine vaccines, the ones that you get from your regular, the public hospitals. Mm-hmm. We might not be able to keep those ones, because those ones, you will get them from public hospitals at a subsidized rate. Mm-hmm. But for most voluntary vaccines, your pneumonia vaccine, your flu vaccines, you'll get them in the pharmacy. And any pharmacy that is registered in this country should have all the necessary equipments to keep them there, to stock them.
Mm-hmm. Yes. Thank you very much. Dr. Chakaya, we are back to you. I remember you mentioned that pneumonia can kill. And I know a young person who was, I think, 20 years old. He just started feeling sick today, and then the following day he went to hospital, died, and then the autopsy said that he died of pneumonia. I'd like to know, how long does it take for pneumonia to kill?
That's a very interesting question, and I would say you can't put a figure to say pneumonia will kill in a day or pneumonia will kill in 3 days or a week or something. Mm-hmm. I think it's important for people to know that most people with pneumonia don't die of pneumonia. I think this is really important. Uh-huh. If you look at research what has been done all over the world, the death rates for pneumonia are under 5%. Uh-huh. So if you have 100 people with pneumonia, less than 5 people will die of their pneumonia. However, we need to know that of those that die, there are certain things that tend to be associated with the risk of dying from pneumonia. So, for example, very young people, if you are a child less than 5 years of age, and the younger you are, the greater the risk that you could die of pneumonia if you get pneumonia. The older you are, greater than the age of 65, the greater the risk that you could die of pneumonia. If you have chronic medical conditions, like we've said, kidney disease, HIV, the greater the risk that you could die of pneumonia if you get pneumonia. Now, for the young person who was only 20 years old, that was a very, very uncommon situation. Most young people of that age can get pneumonia for sure. Their rate of pneumonia is actually not that high compared with the others. And usually most people at that age don't die of pneumonia. So it's a bit surprising that that individual died of pneumonia. And the question, therefore, that would run in the mind of any clinician is, was he having an underlying condition? Did he get a germ that is not the usual kind of germs? Did he delay in getting medical treatment? Was he treated with the wrong medicine? There are so many possible explanation for that pneumonia death. But generally speaking, as long as people access medical care, and good medical care for that matter, quality medical care, the death rate for pneumonia are very low. And all those deaths at the end of the day can be prevented by appropriate treatment. And like we have said, vaccination helps to prevent many of those deaths. You don't get the pneumonia in the first place.
Okay, thank you. We've talked about vaccination at length as one of the tools to prevent pneumonia and influenza. Do we have any other ways that people can prevent themselves from getting these diseases apart from vaccination that you would recommend?
I think my colleague touched on that a little bit. I think the most important thing is what some people call healthy living. Being aware of your health and doing things that help you to preserve your health. And nutrition is top on that list. And it's good nutrition. In this country, I think we eat very badly because all we eat is big white ugali and a lot of meat, and that's not good nutrition. I think there has to be in this country a big move towards educating our population that nutrition is health. Good nutrition is health. Number 2 is regular good doses of exercise. This is very important. When you exercise, your immune system becomes alert and it will pick up things that ordinarily would maybe in people who don't do this kind of thing, you might be causing problems. Avoiding toxins, including the toxins that we tend to voluntarily take on our own. Smoking, for example. When you smoke, you introduce into your body thousands of small little poisons that over time will affect your health, and that could lead to pneumonia. And fourthly, alcohol, how much alcohol we take. Those are very basic things. So good nutrition, exercise, social networks, reducing exposure to toxins and so on and so forth are very helpful. But there's one thing that I think I should talk about here, and that is the role of air pollution. Air pollution at the home and air pollution outdoors. We live in an extremely polluted environment, and the more we continue to pollute our environment, the greater the risk of these diseases like pneumonia and many others. So at home, what are we using to cook our food? If we are using firewood or cow dung or whatever, and our homes are extremely polluted, the risk of those who live in that home developing serious conditions like pneumonia is very high. But also how we go around in our cities, with cars and industries spewing smoke everywhere, that also increases our risk of getting pneumonia and many other conditions, including hypertension, diabetes, cancers, and so on and so forth.
Thank you so much, Dr. Chakaya. We are coming to the tail end of our conversation this morning, and I just like my interviewees rather, to just say maybe the last word, what they maybe have not asked, what they feel people should know. And I'll start with you, Dr. Matolo.
Yeah, so prevention is better than cure. I think we need to build that understanding, that culture of healthy living, and taking the necessary vaccinations is actually part of healthy living. So the information around the vaccines that one is eligible for can be provided readily by your primary care doctor, but also if you research that, that's something that can be done. So at Old Mutual, we are creating that awareness among our members. We have clearly specified that these are benefits that they are able to access at any point, and we've told them how they can access it either through Good Life or any of the other pharmacies that we work with. So we want to ensure that people are taking care of themselves, they are taking the necessary vaccinations, so that they do not end up getting diseases like pneumonia or influenza that are going to either become bad. It can lead to death. Yeah, but most importantly, it's actually going to affect the quality of life. And maybe just to mention, I think the beauty about vaccination is that they're one of the most successful inventions of medicine. There are diseases that have actually been eradicated. Yeah, if you talk about things like smallpox. Yeah, so in the 70s, there was a concerted effort led by the WHO, and smallpox was actually eradicated. The last case was in 1977, and since then, it's not been there. I think if you talk about things like polio, which used to cause a lot of paralysis, polio is almost on the verge of being eradicated from the face of the earth.
Yeah.
It used to be in more than almost 200 countries in the 80s. Right now, it's probably 2 or 3 countries that still have a wild circulation of polio. So vaccines do work, and they can help people lead long and healthy lives. And that's what the message that we want, especially for our members at Old Mutual Health to know.
Thank you so much. Dr. Chakaya.
I want to thank firstly for being given this opportunity to be here. And I want to address, as we finalize this, I want to address one big issue, which is vaccine hesitancy, which is a big problem in our part of the world. There are groups of people in the world that have been and continue to be against vaccines for all sorts of reasons. And the most common reason is that, this might affect fertility, this may be a depopulation agenda, and so on and so forth. But I think we need to go by the science. Vaccines, as far as I know, are developed through a very rigorous scientific process. And they are safe and effective. And so when you hear people say this is a depopulation agenda, please cross-check that information. If there was a depopulation agenda against Africans, for example, how come that in COVID-19 vaccination, 90% of the high-income countries vaccinate? No, 90% of the population of high-income countries was vaccinated. Here in Kenya, only 30-something% of us were vaccinated. Why would anyone vaccinate their own people to kill them when in fact the enemy is the African? There's some very basic things that one should cross-check before believing that some scientifically produced product is detrimental to health. I think we need to cross-check information before we act on that information. And I think for me, vaccines, like my colleague has already said, provides not just it's not the only answer, certainly to our healthcare problem, but it's a major contributor to the answer of infectious disease and how we manage infectious disease now and in the future. So,
Dr. Karuma, last but not least.
Yes, thank you for the opportunity and the platform to be able to discuss about vaccine-preventable diseases, influenza and pneumonia for that matter. I want to talk about availability. we have a lot of vaccines available in this country, and I'm saying from a part of a person who stocks and sells. Every year, we go to the incineration room where we incinerate our expired products, and we'll always get a vaccine that is being incinerated. I heard what Dr. Chakaya said, around 3 million people are dying due to pneumonia globally. Part of those people is happening in Kenya. Yet, we are incinerating vaccines that can be put in arms and make sure that people don't get these vaccine preventable diseases.
Yeah.
Please come to the pharmacy. If you don't feel like visiting your hospital, although hospital is also a good place to visit, but if you feel you feel more comfortable coming to the pharmacy, come to the pharmacy and you get vaccinated. Number 2, to my colleagues, let's start stocking these things so that they are available closest to our customers, our clients, our patients, our friends. Let's have these things as close as possible, these products as close as possible to you, the people we serve.
Thank you so much. To our listeners, our time has come to an end. I feel like we should go on and on and on because I'm just thirsty to get that knowledge of these experts that are here with us, and they're giving us information free of charge. I know if you'd go to Dr. Chakaya's clinic, you'd have to pay for this information, but here you're getting it free of charge. So if you have any questions, you can comment on our social media pages and we'll be able to reach to you after getting the feedback from our experts. And if there's one thing that I've gotten from this discussion today is don't listen to me, listen to the science. That is something that my colleague Leon Lidigo likes saying, and please listen to the science. The vaccines are safe. You should get them if you're eligible to get them. Thank you very much. See you next time.